So we'll talk about another pregnancy issue, and this is what is known as a molar pregnancy. All right. So you can see this is a normal pregnancy where an embryo, that's what the sperm and the egg that have fertilized and have started developing or dividing to an extent. The implant in the endometrium, everything is peaceful. But in a molar pregnancy, you have a huge tissue coming up. Let's look at this picture again. Can you see? It's so huge. The cells are abnormal. It's not an embryo cells. Okay. So what's a molar pregnancy? It's just a rare complication of pregnancy. It's not common. Right. This is where abnormal tissues grew inside the uterus. Okay. Instead of a healthy placenta. One thing is, as the embryo implants, okay, the placenta starts developing too. Placenta is that communication between the baby and the mother. Okay. But instead of the placenta coming up, you have these abnormal cells coming up in a molar pregnancy. So it's part of a group of disorders called the gestational trophoblastic disease, and usually result from genetic errors during fertilization. Okay. So for the types of molar pregnancy, you can have the complete one. This one, no embryo forms, only the abnormal cells. The partial one, this one, the embryo is forming, do you understand? But it has too many chromosomes and cannot even survive. So it will basically lead towards abortion. Yes, that's what a molar pregnancy usually ends in. So symptoms, how would the woman having this issue be able to, how would she be feeling? So she's bleeding, and this is just the first trimester of pregnancy. She wants to vomit or she's vomiting, Grape-like cysts, okay, passing from the vagina. All right, can you see this? They are balls, so they'll be falling off from the vagina. Rapid uterine growth. Her stomach is, too big for first trimester. This is because you have abnormal cells. If you check human gonadotrophic hormone, the levels are shooting up. Okay. Signs of preeclampsia, like she's having hypertension. All right. Then pelvic pressure or pain. Okay. So diagnosis, you want to actually look into the uterus. So if you want to look into the uterus, of course, you might want to use imaging like ultrasound. Then you want to actually check for human gonadotrophic level. You use blood. Then you want to also examine the pelvis. You palpate just outside. Okay. Look at where the pain is localized. This will help you know that, okay, this is actually from the uterus. So how about the treatment? Dilation and curettage, where you try to remove, the molar tissues. Okay. Then monitoring human chorionic gonadotropin levels, chemotherapy, hysterectomy, all of this, all right, are important.